Good afternoon and welcome back to the Lynn Lowdown. I'm Danny Vittori, and today we have on representatives from the Greater Lynn Senior Services and Mass General Brigham. Thank you both for joining us today. Great. So first of all, would you mind just quickly introducing yourselves and the organization you're affiliated with?
Great. Thank you so much for having us here today. My name is Tina McLoughlin, and I am the Director of Community Health for Mass General Brigham Salem Hospital.
Awesome.
Hello, and thank you for having me here today as well. I'm Valerie Callahan. I am the Senior Director of Population Health at Greater Lynn Senior Services.
Awesome. So we're here to talk about the Phoenix Food Hub Community Grants. Before I jump into that, would you mind just giving a brief overview of kind of what the place you work for, their main mission, work here that's done here in Lynn, or in the surrounding community, of course?
Great, of course. So at Mass General Brigham Community Health, we are committed to reducing the health disparities in the communities that we serve. And I think it's worth pointing out right at the beginning that over 80% of the variation in health outcomes is outside of medical care. It's caused by factors such as nutrition. Mm-hmm. So at Mass General Brigham, our community health team is committed to partnering with organizations like Greater Lynn Senior Services to address what we call the social determinants of health, like nutrition, mm-hmm. so that we ultimately can improve the health of our communities and reduce the health disparities that exist.
Awesome.
So I am from Greater Lynn Senior Services, and Greater Lynn Senior Services is coming up on its 50th birthday, which is really nice. It began as something called an aging services access point, and it remains so. But while for the first, say, 40 years of its existence, it focused on elders primarily, now we actually work with all populations in many different programs, and we are now focused on social determinants of health and community livability in general. And our reach has gone well beyond Lynn. We are also in other communities in northern Massachusetts as well, working on a lot of different initiatives, and certainly working on nutrition security is one of our key priorities.
Mm-hmm. That's such a huge piece of keeping people healthy, and these community grants, that was a piece of it. There were 10 awarded for programs that really address food insecurity. That's correct?
Yes. So maybe just a little bit of background, and Tina, please jump in. Mass General Brigham has generously supported Greater Lynn Senior Services and other organizations in Lynn through what was initially called the Food Security Task Force, which has now become the Food Policy Council. And what came out of that was really the boost that created the Phoenix Food Hub. And Phoenix Food Hub is all about figuring out how can we make a one-stop nutrition support center for everybody in the city of Lynn. And so what we wanted to do was to create as many different programs that really relate to how folks find themselves food insecure. Yep. So it includes not only access to food, but access to how to prepare food, understanding of how to create a diet that is healthy, understanding of how to manage meals and so forth and so on. So it's a wide variety of programs. I start to move around with my hands a little bit, and I apologize for that. You need a catcher's mask, I think. But at any rate, we wanted to create this, and Mass General, thank goodness, came to the fore and said, yes, we want to support you doing that. Now, where the community grants come in is that Phoenix is a hub,
yes,
and it is really designed to bring people in the community to the center for many different reasons, but there are many people who cannot come to the community center, hub, and they are in the outskirts or they are hidden populations, and so we wanted to pull in the organizations who work with those folks in many different ways to create this sort of push-pull. So we wanted to really enhance the social magnet aspect of Phoenix Food Hub while at the same time making sure that we penetrated throughout the entire city. So the community grants, and I know I'm a little bit long-winded, but the community grants were an effort to identify those organizations who connected with those populations that might have a little bit more difficulty finding Phoenix Food Hub on their own.
Yeah. Great, and I would just, add that from at Mass General Brigham, given the enormous connection between access to food and nutrition-related chronic diseases like hypertension. We have made significant financial investments in many different communities to increase food access. So, the investment in the Phoenix Food Hub was one of many investments of this sort, whereby we were really trying to improve access to food and nutrition in select communities. And as Valerie mentioned, as it relates to the community grants, the City of Lynn did a food assessment about a year or so ago, and transportation continues to be one of the biggest barriers to food access. And so to be able to really focus on creating this sort of hub and spoke model, if you will, where we can not only have this amazing one-stop shop, food hub at the Phoenix Food Hub, but also then to sort of have I sort of view these community grants as like the spokes, right? So that we can get all of the amazing resources and services that are available at Phoenix Food Hub to those who have barriers accessing them directly on site.
Because it covers so many things like food markets, things for various age groups, teens, adults, everyone. And you said it really connects all these people who maybe can't reach you, but maybe they can reach one of these other organizations.
Right.
And as for if anyone's listening and maybe has an interest or needs access to these resources, what would be the best way for them to kind of get connected to them?
So they can connect with us at the Phoenix Food Hub. There will be another round of community grants, I believe, starting in the spring, the later spring. We've done 2 rounds so far. And we have distributed 20 separate grants, not to 20 separate organizations necessarily, but quite a number of them nonetheless. And they run really an exciting range of focus. There are some that are transportation grants that are taking people back and forth to where they can, in fact, access food. There are others that are bringing people into the center to do cooking classes of a particular kind, maybe with younger people or with folks who have a particular interest in learning a cultural cuisine. There's also a number of the grants that are funding folks to go on mobile trucks with food. Around to different places. And as I said, many of these organizations are really connecting with particular populations who I think would be more reticent to come forward on their own. So it's very exciting. And I would add that while Phoenix Food Hub is certainly funded in large measure through MGB, there are other funders as well, but no other funder for the Community Grants Program. So it is solely funded through Mass General.
Wow, that's a very impressive investment. It's being made.
Thank you. And I would just say one other point in terms of accessing the amazing resources that are available through the Community Grants Program, as well as all of the other resources available at the Phoenix Food Hub and many other organizations in Lynn. A great place to also get information and get connected is through your health provider. So at Lynn Community Health Center, which is an amazing organization here in Lynn, and at many other provider sites, including the Mass General Brigham provider sites, we've done a tremendous amount of work for our care teams to screen our patients for social determinants of health, and then have trained community health workers and other employees that can help our patients then become connected to these amazing resources. So that would be another point of access that I would encourage all of the listeners, to pursue, is to talk to your doctor about any, social determinants of health and resources that may be available for you.
And this partnership is, you told me, about 3 years in the running. So 3 years, you've given out 20 grants, all this connection, which has been amazing. But what would you say has been the greatest, benefit so far to working in tandem?
Well, Phoenix Food Hub, I think, is evidence of one of the greatest benefits.
Yes,
it is
definitely
growing, and it is serving a lot of folks, and I think serving them in ways that are pretty critically important. So that's certainly number one. I think the other is we begin to talk about sharing information in many more tangible and, I think, immediate ways. So there are all sorts of technology kinds of things that we can potentially work on together, and hopefully will, as well as understanding the relationships between certain changes in the social determinants of health and the impact on health. I think that's the ticket going forward, is that we have to be able to demonstrate that investments like this in the community actually make a big difference in health outcomes.
Yes.
And so working together on that and knowing that we will be working together on that, I think it's usually positive from my perspective.
Oh, yeah.
Yeah, and I would just add that, community collaboration and community engagement is at the core of anything we want to do to improve the health of our communities.
Right.
And so whether we're talking about access to nutritious food, whether we're talking about implementing new programming related to substance use disorders, whatever the focus is, I think the way in which we collectively are going to improve the health of our communities, which is what we all ultimately want to do, is through true, genuine community engagement and collaboration. And so I think that this what we've done through Phoenix Food Hub, I think not only improves access to food and nutrition, but I would say even more importantly has created this replicable model of what true community engagement and collaboration looks like, and what we can achieve when we approach it in the way that we did.
Right. And as Tina referenced earlier, health happens in the community, not in the doctor's office or in the hospital. But yet we need the folks who are on that side of the clinical line to be very involved on the community side as well. So, and we on the community side need to be able to demonstrate outcomes. So I think this is where we're going.
You definitely demonstrated the outcome and have been to Phoenix Food Hub before. It is definitely a model that could be replicated and has seen such success. And I do have to wrap up in a moment, but I just want to thank you both again so much for coming on to really share this with the community.
Oh, thank you. Appreciate the opportunity.
Of course, thank you anytime. And once again, I'm Danny Vittori. This has been the Lynn Lowdown, and we'll see you next week with more guests.